the whole family of anxiety disorders benefit from treatment with exposure techniques. And that's one of the kinds of treatment that the Worcester Center for Cognitive Behavior Therapy specializes in. You have a disorder if it is interfering with your functioning, interfering with your daily life, or if it is causing you a lot of distress. So, when a parent says, they're right. They're noticing that something either is interfering with a child or a teenager's ability to go to school, play, do homework, enjoy life, or that their child is experiencing too much distress, and for oneself also.
Dive into an example, because this can really help us understand what exposure therapy is, and also give some kind of tips to how it works and why it's effective, as you were saying.
About a little girl, Sue. She was 4 years old at the time I first met with her. She had what's called selective mutism. So that means that at home she chattered and talked and played and danced and sang like a normal 4-year-old girl. And her parents came in and showed me video of an entertaining, happy 4-year-old girl enjoying her life with her parents and her brother at home. But in all public settings, at her daycare, at her preschool, at social gatherings involving her family and other people, she was not only completely silent, never saying one word, but also physically frozen. She would truly be frozen, like a deer in the headlights. No facial expressions, no eye contact with other human beings, and no play, exploratory behavior, and certainly no talking. So not hard in that situation for the parent to realize this is not right. She's not doing the age-appropriate normal things, which would be, after an initial few minutes of being a little shy, being able to open up and play and enjoy yourself at daycare, preschool, or in interaction with extended family or neighbors and friends.
And how would exposure therapy break that down, what's happening to her, and move her to the first plateau or the next place?
What we did, and this is something that's really important about cognitive behavior therapy, it's not just sitting and talking in an office. What I did in this case is at first I did interact with her in my office, really just for one session. And then she and I and her parents went to the ecotarium, to the preschool play area. And I played with her and engaged her and myself in playing with other kids there in the ecotarium preschool play area. We went to Elm Park and I engaged her in interaction with adults and children, strangers. They're at Elm Park, they're at the ecotarium play area. Then I went to her daycare, I went to her preschool, I went to her home, and then the main thing that I did is teach her parents by modeling for them and explaining to them what I was doing. I taught her mother and her father to continue doing that with her 24/7. That's a very important thing about cognitive behavior therapy for children and teens. It's not drop your kid off, 45 minutes, they're in a private room with a stranger, you don't know what they're doing, and your kid is fixed, 45 minutes. No, it's the parent being coached and trained to create the right situations and the right incentives to help the kids' behavior to change 24/7. So I trained the parents to create situations, ideally every day. They didn't quite do every day, but they did a lot. They created situations in which she had exposure to the opportunity for social interaction, and she was praised, specific labeled praise, high praise, for anything resembling socially appropriate behavior. So she was initially completely mute in all circumstances. So initially, we focused on her parents directing her and inducing her, coaxing her, and then praising her for just making eye contact, just smiling, just looking at the person, just not running away or freezing. And then we gradually led her kind of up a set of stair steps. You can think of it as climbing a ladder. In cognitive behavior therapy for anxiety disorders, we're always doing progressive, step-by-step, baby step exposure, starting where you are, going to where you want to be, gradually, step by step. So the parents would create situations, take her to buy an ice cream. You get the ice cream as a reward. You get high praise from your parents for saying what flavor you want or saying what kind of cone you want. And progressive, starting with just wanting her to make eye contact and giving warm, enthusiastic praise for that, ending with her selective mutism completely went away and she started at parties with extended family members and friends, dancing and doing skits. So, but that was done step by step.
And you, in being able to work with the parents and having the parents involved, the parents also, because it sounds like you create a safe space for the child to move in a direction. And the parents must also go through some kind of homework so that they don't feel, I'm not doing enough, or, because if it's a slow process, you can't get just caught up in the process. You have to always be saying, I am taking a step forward, the child is progressing.
Yeah,
I would think.
Yes, absolutely. So I was also praising the parents for what they were doing, and I was having them do progressively more and more. I also worked with the child's teachers at preschool and at daycare, so that, and went to an IEP meeting, so that really the child's whole community, all the child's environments, everybody
was on the same page.
Was on the same page, helping the child to gradually increase the amount of age-appropriate, social, communicative interaction that she did. And yeah, it's, absolutely, the parents need to feel confident, parents need guidance, parents need coaching, and that's the job of the cognitive behavior therapist in that kind of situation.
And how long did that particular one, I mean, I know everyone is different, but I mean, do people do this for years and years?
No, that took about 4 months.
And that was once a week or twice a week? Or?
I didn't meet with them that often. It was probably a total of 15, 16 visits. Some of the visits were 90 minutes long of me working with both parents and with her and her brother. And of course, many of the visits were out in the community. That's another thing that distinguishes cognitive behavior therapists from traditional therapists. We are doing the work where it needs to be done, which might not be in the office. With somebody who's phobic about driving, I go drive. With somebody who I treated recently whose phobia was about heights in airplanes, we went to the Worcester Airport. Focus in cognitive behavior therapy for anxiety disorders is to make a distinction between the person and the disorder, and to ally or have the parents and the teachers and the therapist and the kid ally with the person against the disorder. And you mentioned going into the computer. There are a lot of really great self-help websites that can be accessed through my website, or I think you're going to put up
we'll put
anxietybc.com.
Thank you so much, and we look forward to having you on again, Jennifer. Thank you so much.
Thank you very much, Ramona.
I am Ramona, and you've been watching Ramona Interviews. Have a wonderful week.